I heard about you guys through, I think, social media. So I believe I first saw an ad for Barefoot Rehab on Instagram. And so I actually had followed you guys for a long time, almost like 8 or 9 months before I first came in as a patient and called Rich. But I think what really inspired me was the fact that I saw that this place had a very different approach to caring for their patients.
So my patient Olesya came in to see me with numbness in both of her hands that was not getting any better no matter what she was doing. Now she had started seeing our neck specialist because when we have bilateral hand numbness, we do generally go ahead and proceed like it's possibly coming from the neck because it's the central part where the nerves are originating from. So if there's something like a bulging disc or just a nerve impingement happening in the neck at where the nerves are exiting your neck, then it's really common that that bilateral hand numbness and pain is actually coming from the neck.
It was great. I was a little anxious about the pain with Nina's treatment, but it was really a good experience because I knew that after 10 years of pain in my arms, that's exactly what I needed. And so I felt amazing relief just from the one session so far. So even though it's uncomfortable in the experience itself, it's definitely 1000% worth it.
So Olesya started seeing Joe, and she was seeing him for a few weeks, but the hand numbness was not getting any better, although her other symptoms were getting much better. So she came to see me last week. And what I did was a comprehensive exam where I tested and palpated and checked for adhesion in multiple areas of the body where nerves can get entrapped by the sticky glue-like stuff we call adhesion, right? So Joe had already checked in her neck and was treating those structures. So I checked here in the armpit where the brachial cords exit, and then they branch off into the different arms that go into your arm and your hand. And what I found was that she had a significant amount of adhesion in both of her brachial cords. All right. She also had it in the radial nerve here on the extensor side of her forearms on both sides. And that's pretty significant because when that happens, what happens is your flexors now have to overwork in order to flex your wrist forward. Because if the radial nerve can't move properly, and then it's also tacked down to the armpit not moving properly, then this has to work super hard to get the wrist to flex forward because this is just sticked and glued down with adhesion. So she also developed a ton of adhesion in the forearm flexors here on the surface because they were working so much harder to move her wrist and hold her wrist in a proper position when she needed to, like typing, moving the mouse, things like that. It was just too much load with everything all together.
For probably about 10 years. So I'm looking at about a decade of just being in constant chronic pain. Working at a computer for a really long time, and I think working in a stressful environment where your body's constantly tense. So I think it was a combination of poor ergonomics with just the hyperactive, like sympathetic nervous system response from everyday life.
So that's what we found on her exam. So for her first treatment, we went ahead and started treating those nerve entrapments. We call it the double crush injury when a nerve is trapped in more than one place. So we started treating those different areas, and she had immediate changes in her range of motion, in which her range of motion started out really poor. She could barely get any wrist extension past 70 degrees, and her finger extension with her wrist was not even greater than 10 degrees. That is definitely a failing grade. What's considered a normal range of motion for your wrist is going to be 90 degrees with no pain. And then with your fingers included is going to be 90 degrees or 85 to 90 degrees with no pain, and then up to 65 degrees of the angle of the finger there, like that. So she was nowhere close to what we consider a healthy range of motion. And she had significant amounts of pain and numbness and weakness. So after that first treatment, she got improvement to 90 and 30 degrees. That's pretty amazing.
I think anyone that's been in chronic pain that really hasn't found relief from other care, whether it be holistic or Eastern Western medicine. So I think for someone who's really looking for relief that hasn't found it anywhere else, I think someone that wants to be inspired to change their life And I would definitely recommend this practice to anyone in my circle of friends or family. It wasn't just a quick fix. I think it's important for patients to realize that going through this journey will really call upon you to change your life. So I believe that for anyone interested in this treatment, I think it's important to understand that you still have to do the work within to make the changes that led to the reason for why you're in pain. But also, you will obtain great relief from the wonderful people here.